in the mother care tracking systems have surfaced. I'll just point out that. Please clarify on that. Loophole number one. As you said, the mother child tracking system sends reminders to expectant mothers as well as to the auxiliary midwife nurses on various treatments. Once the mother receives the treatments, the AMNs, that is the nurses, have to send details back through an SMS. It seems the government is not reimbursing the bills of these nurses, so many, it seems, have stopped sending messages. Is it true, Mr. Salokkumar?
No, it's not entirely true. In the initial phases, when we were not very clear on how we are going about, that time we have requested them to send it through their own mobile phones. That time they felt that they are sending it and at their own cost. But later on, we have reimbursed their bills, and we have gone ahead one step forward with giving a with giving a CUG mobile SIM cards. So whoever is having the mobile phone, they can put it in their mobile phone, and they can use these SIM cards. The SIM charges we are paying from the state.
So
And also we are providing them incentives for sending these messages. So it's not that they are all deprived, but initially yes, they had a difficulty, which we have rectified at the later stage.
You want to add to that?
It's correct. We have provided common user group SIMs from BSNL to all ENMs. All SMS are free and unlimited talk time in between the CUG, 24 hours by 30 days. So that they can contact anybody, they can speak to anybody, even the pregnant woman or the child shifts from one geographical area to another area, absolutely no problem. They have the database, they can speak comfortably to the ENM and say, this mother is shifted, please take care.
So loophole one has been plugged.
Definitely.
Loophole number two. Kannada script is not compatible in most mobiles. So Kannada messages appear as distorted boxes and lines. Moreover, most rural folks do not know English. How have we solved this, Mr. Shankar?
We are working on this technology. For the time being, when we send the SMS, we are sending both in English as well as in Kannada. Suppose if the mobile is compatible to Kannada, they can comfortably read with that. If not, we are working on the technology. It may take some more time to come with that. Because suppose if you send it based on the Unicode, it will be converted and it will be read as Kannada script. It will take some more time, I think. That is the first thing. Second thing is, for ANMs, it will not be more difficult. The reason being, we will send the message in such a way that they can comfortably understand it. Thai card number, name of the pregnant woman. They will and the service to be provided like TT1 or ANC2 or IFA tablets. So they will come to know this mother, this Thai card, and reading the names is not that difficult, what I personally feel.
But rural people do not know English still.
No,
And AMNs also belong to the rural area.
Yeah.
Yes, sir.
Yeah, they all have been using English forms in their daily working schedules. I don't think they may have such a difficulty in reading this small message. This message is it's not very complicated message. It's saying number, name of the lady or pregnant women, and then the service to be provided. So these three only are there. They are in a position to read. Of course, when you talk about the pregnant women, there is a difficulty. Yes, they need to seek the help of somebody who knows the language of English. As Shankar had put it, we are working on improvising this technology to use a local language. We are also trying to explore the possibility of procuring Unicode compatible systems which can take Kannada local language as a receiving message. So I think in a month or so we may be in a position to address it. Yes.
Good. That's a good thing. Loophole number three. There is a lack of awareness among the citizens about this tracking system. The government hasn't done much to create awareness apart from putting out a few advertisements in newspapers.
I partially agree and partially disagree with the statement, because as I have already mentioned, our ashas are there, present omnipresent everywhere in the system. They are able to create awareness among pregnant women as well as the family members of the women. Recently we have started uh, verifying the records, whether they have correctly entered the data, whether the same women is getting the services. So, from our control room we have started calling back and verifying the services provided by the ANMs. We could see that almost 99% data is accurate, in the sense whatever SMS they have sent, whatever data they have fed in the system is correct, and they are able to respond to it properly. So, it's a question of creating awareness among urban areas, which is still an area of concern for us. The awareness in urban area is still a weak area, because our National Rural Health Mission is not catering to the need of urban, particularly city, municipal council and above areas. We are working on creating awareness among urban women as well as urban health workers, one. Second, we are also trying to put extra manpower to capture the information 100% from the urban areas.
So when will this happen, the urban thing?
Urban is quite a challenge, because our state is having around 38% urban population. We require almost a parallel kind of a setup, which is existing in a partial manner. We need to strengthen that system, and then we have to strengthen our own networking.
Urban poor is as bad as the rural poor.
I agree.
Rural people, I
Yeah.
think they should be taken care of.
I agree with this, but since the government of India and government of Karnataka has focused initially on rural areas, because the infant mortality and maternal mortality rate which is prevailing in our rural areas are far higher than the urban area. So, we had to focus mostly on our rural areas. Now, having addressed the issue of rural problems, we may be now in a position to address the urban problems easily. So, we are moving towards that. It may be a question of months before we take into the urban kind of an intervention.